look, I was told you'll never get DHHS finances under control and you will never reform welfare. And I led the charge to do both alongside the governor. That is what absolutely gives me the confidence and the optimism that we can turn our tax structure around.
Hi, my name is Matt Gagne, and I'm the CEO of the Maine Heritage Policy Center, and this is actually our first in a series of gubernatorial candidate interviews where we'll be talking about the issues to everybody we can find running for governor right now. We've invited all the candidates from all major parties, as well as the independents, to join us for this. And first up with the very first interview is Mary Mayhew, former Commissioner of Department of Health and Human Services and Republican candidate for governor. Mary, welcome.
Thank you, Matt. Happy to be here. Happy to be number one.
Indeed. So just to get right into it, for the audience that's looking at this, we're going to be having a policy conversation here. This isn't going to be about the political horse race or about what candidate's doing what, no back and forth on these sort of political issues you see oftentimes at political debates. We view this as an opportunity to get a little bit more in-depth on a lot of these issues than you would get in a 2-minute answer from a debate when you have a number of other candidates on the stage. So hopefully this will illuminate the audience about what you really think about policy issues, sort of in your own words, without all the spin and campaign nonsense with it. So to get right into it, I think the first and easiest one to ask for you, I would hope, is just a really simple question on what made you decide to run for governor? What motivated you to get involved?
You know, it is interesting because it's not something over the last many years that I had thought that I would get into a political race. But having had the opportunity over the last 7 years to have worked closely with Governor LePage, to have been in the trenches, literally, taking this state back and putting it on the right course, I didn't want to see all this great work undone. We really have so much to be proud of in Maine in what we've done to restore fiscal discipline, common sense, prioritizing the needs of our elderly and disabled, respecting businesses, and really rebuilding our economy. So I wanted to make sure that we not only protected Governor LePage's legacy, but I wanted to make sure that we stay the course, and that's why I got into this race.
Well, over the course of the next hour or so, we should be talking about all the issues that you might have to deal with if you become the next governor, from education to healthcare to taxes to spending to government reform. So I think one of the ones that I haven't had an opportunity to talk to any of you, the candidates, about too much in the last, say, 6 months or so when you guys have been running, has been the issue of education. I did the St. Joseph's debate with you, all of you, and we also, of course, did the radio interview on WGAN, and didn't really get a chance to talk about this issue too much. And what we've seen in places like, for instance, Scarborough, is that there is a real grassroots movement of parents and families and even teachers who seem unsatisfied with the state of education in Maine. And specifically, they seem to have a problem with this proficiency-based education stuff. And for those who don't know too much about it, it's worth looking into, of course, but it's something that's a motivating factor for a lot of parents. So I guess my first question to you to lead off would be your thoughts, broadly speaking, on the notion of proficiency-based education and what you think the implementation has looked like and if you think it deserves some reform.
Well, I lump it in with all the other noise in the educational arena that's detracting from a focus on our kids getting what they need to be successful in school and once they've graduated. Look, we have made this typical of government. We've made this so overcomplicated, and we really have lost that laser beam focus on what are our math scores, what are the English scores, what are the science scores, what's the graduation rate. Let's get back to what we all understand. I get that parents, as a parent, I'm frustrated. I remember talking to one of my son's teachers at a parent-teacher conference, and I said, so how's my son doing? And the response back was, well, haven't you checked the portal? No, I'm asking you. And I think all of this noise and the changing expectations have really moved us away from concrete, measurable outcomes. I was just at Baxter Academy, and I was blown away by the work that they're doing in that charter school. I met with all these students, Matt, and I'm just going to tell you right off the bat, I was meeting with the kids on the robotics team, and they said, well, we use a Gantt chart. I said, well, you had me at Gantt chart. The fact that you know what a Gantt chart is, that you're doing this critical thinking, project management, here's what I know. It's one thing to look at strategic strategies, best practices in the classroom. It's another thing to continue to change where the goalposts are.
But when it relates to proficiency, it's interesting. This was something that was brought in by Republicans. I mean, when Governor LePage took over, it sort of was in that era. And the goal that I remember being told at the time was that it was an attempt to get back to being proficient in some basic stuff. Math, arithmetic, English, and so on and so forth. But it seems to me that nobody understands what proficiency means. There's no clear definitions of what it is. And teachers, administrators, and parents are very confused about what the requirements for their own children are going to be. Is this something that deserves to be fully repealed? Is this something where we can clarify what proficiency means? Can a student even be proficient in all of these areas?
I think it's a recipe for disaster. When parents don't know, when teachers don't know, when students don't understand, when administrators are trying to cope or figure this out, that's a problem. And I've seen too often, too much time spent wheels spinning, trying to fix something that at its core has too many flaws. How often do we say, Matt, if it wasn't broke, why are we fixing it? I mean,
Right.
It's not to suggest that the educational system has been operating on all cylinders, but we've got to get back to focusing on the classroom, having a handful of measures of success, and evaluating progress towards those measures. Look, I draw a lot of parallels between healthcare and education. A lot of money being spent, but not a lot of clarity around outcomes and the efficiency with which the services are being delivered. I have a lot of experience with what I did at DHHS within the Medicaid program of getting away from, first of all, not only just crisis-oriented spending, but it was all just transactional. Claims in the door, payments out the door. But no one was asking, for the $2.6 billion spent, are we seeing improved health outcomes, and are we spending the money efficiently? Think of the $160 million that was just thrown at schools last year.
Right.
Was anyone saying to what end? We want to see these improved outcomes associated with this additional funding? No. It's a huge problem.
Now, can anything be done in the environment that we currently have with the federal government? I mean, specifically, I'm thinking of the Common Core requirements, which, again, were something that were brought in, I think, in the early days of a Republican administration with a lot of, sort of optimism and hope about it creating a better educational environment. It didn't seem, obviously, to do that. Measuring outcomes and trying to adjust how we at the state of Maine do our basic K through 12 education, is it even possible with the way that the federal government is involved in this?
Well, I certainly have hope with the Trump administration. I dealt with federal agencies. I know what the entrenched resistance to change is, the level of micromanagement that often happens with a federal agency. They're trying to justify their existence. They grossly overcomplicate. There's a lack of common sense. Yes, I am confident that with the right leadership at the state level, that we can create a Maine-based approach to supporting the best possible educational system and outcomes. Now, we need to balance that against local control. Mm-hmm. But I think with the money being spent at the state level, there needs to be some accountability and expectations related to that funding. When Steve Bowen was first commissioner of the Department of Education, they did report cards on the schools that I loved. That's transparency. It is something that was very meaningful to parents, to students, to teachers. We need to get back there so that everybody understands what it is that we're trying to achieve. And then we can talk about what's the best way to achieve it. What kind of innovative models do we need to be supporting that help to achieve those outcomes?
You bring up local control. That's an interesting conversation, particularly when Governor LePage has been so adamant about the administrative cost of basically delivering school services across all the communities in Maine. Again, here you're presented with a sort of conflict where you are seeking as much local control as possible. You want to have local communities basically govern themselves, particularly as it relates to the education of their children. But at the same time, you are being strangled by cost. I mean, there's so many administrators, so many superintendents, principals, etc., that it's overwhelming the ability of money getting into the classroom in a lot of ways. Where do you, I guess, philosophically stand on the balance between that local control and trying to fiscally manage the state and its education services?
I'm sure people will say, well, we've done this with some of the aspects of the school funding formula, but that, to me, again, that has become so politicized, so complicated. It lacks the kind of transparency and accountability. We need to create standards around efficient spending on education. This should not be complicated. What does it cost to educate a child? What are the administrative costs, fixed costs? What are the classroom costs? And we need to create at the state level a clear, standardized approach to that spending. Now, what a local school may want to do on top of that certainly should be up to them. But we have got to create a more standardized approach to the efficient use of those funds that drive a more efficient or a discussion at the local level around how do we maximize these dollars.
It seems like there's so many different approaches to doing that too. I mean, Governor LePage's approach to school consolidation was far more carrot rather than stick, which is what I think the Governor Baldacci's approach was. But as you evaluate, just as an example, Governor Baldacci's school consolidation program, do you think that he was on the right track and it was executed poorly? Do you think that it was actually a good idea to go the direction he was going? Evaluate, I guess, that briefly, and then maybe sort of contrast it to how you see Governor LePage's approach to be.
Well, I don't think that you can both try to force it, but then allow decisions to be made by the very individuals whose jobs are going to be or should be eliminated. And that's exactly how it happened under Governor Baldacci. You were asking the very people to pick who's going to stay on the island and who's going to be eliminated, right? That does not work. I think you have to have you have to have consensus around, yes, this is an efficient delivery of this service. And you've got to eliminate and understand where there's duplication. We know we've got excessive administrative costs. We know that special education costs have skyrocketed in this state. Those are two major drivers, cost drivers. So then the question has to be, what's preventable about that spend? And how do we get it out of the system? If it's not through consolidation, what are some of the voluntary cooperative approaches that schools need to take? But I don't think you change any of that until you say we're only going to pay X to cover these costs. Mm-hmm. And that has to drive local schools deciding how do they deliver the service, either within that defined amount or what do they do locally, either through additional funds or through regional cooperation. Because it's not going to be a one-size-fits-all.
Right. As it relates to education, you brought up the question of the additional money that was spent at the legislative level after Question 2 was passed with the 3% surcharge and getting rid of the tax to pay about $160 million extra to the schools. The question of money and how much it costs to educate a student. It seems to be a constant debate that never ends. The goalposts continually move, in my opinion, where money is never viewed as enough. Every time an increase in a budget occurs, there's always the statement made by, for instance, Ethan Strimling, mayor of Portland, who's on a bit of a kick about this right now himself, that if we only had more money, we'd be able to do X, Y, and Z.
It's not about money, Matt, and we know that. It's not.
What is it about then?
It's not about money. Well, at least
I live in Yarmouth, and I apologize for interrupting you, but I live in Yarmouth, and it's the number one, according to U.S. News and World Report, it's the number one school system, public school system in the state, and it's number 200 and something in the country. People like Ethan will point out that per pupil spending is extraordinarily high, classroom size is very low, and he puts the impetus on those things as why it is producing such quality education results. Do you think that there's a role in that for that, or is it about other things? And if so, what are those things?
Well, I think we all know that parent engagement, parent support, stability for the child, is the child coming to school ready to learn? Those are all societal issues that do not necessarily, yes, it can be socioeconomic, but those are not areas where there is a government fix. In fact, I would argue that government has contributed to the decline in families where women are choosing government over husbands. So let's understand that there's more here than just throwing money at a school. What I would suggest is that we need to take a look at what are the outcomes that we want to achieve and how do we support efficient delivery. Look, same thing again in healthcare. Look at the Medicaid program, right? It was always more, we need more, we need more, we need more. Nobody was analyzing the cost of delivering the care. I've done that. We did that. We looked at various services and we analyzed the costs. We looked at labor data and labor markets to understand, well, how much should we be paying or should be part of the reimbursement rate? That has not happened as we look at schools. There's not the kind of transparency. The Portland school system and the debate with the city council is such a great example. There's such a lack of transparency of where the cost drivers are, and are these really priority spending?
Mm-hmm. With those debates, there's always things that are included in them. I mean, we hear a lot about pre-K education and how that sets people up for a pathway of doing well in school going forward. Do you think that there's any kind of role for that type of thing to be funded by the government, or is that a bit of fool's gold?
Well, I know that I had the opportunity to oversee a number of early childhood programs. And again, I think education has not had the kind of rigorous evaluation around accountability. So when I sat down with a group of Head Start directors and said, so your mission, as you've described it to me, is to help children be ready to learn when they enter kindergarten. Show me the data to demonstrate that you in fact have met and served that mission. And at the time, they said, well, we don't look at it the same way. Well, that's a problem in terms of evaluating these programs. We all, I think, certainly agree that getting our children ready to learn is vitally important. I think the question is whether or not government needs to be directly involved in supporting that. What we all acknowledge is mostly it is about being socially ready to be in the classroom, to be with other kids, to be prepared in kindergarten to start learning. And then we're going to look at how are they doing by third grade? Are they at the reading level that we would expect to see?
At the same time, when we talk about evaluating performance and, rewarding good teachers, oftentimes that's brought up when you're talking about trying to have teachers and educators paid more, is trying to incentivize quality evaluations and make sure that you're actually paying good teachers. What we've found in some regards, though, is that, for instance, with No Child Left Behind, money is tied to these results, and these results are often either fraudulent or there are other explanations for them. I'll give you an example. My wife is a teacher. And when we were living in Virginia still, she had frequently been given children that had recently moved to the community and were English as a second language kids, and they began like 3 grade levels below where they were. And by the end of the year, she was getting them basically up to grade level. And so if you were evaluating her performance, it would be good because she was doing a good job, but you'd be getting kids at grade level, right? If you had the other classroom, which absolutely happened to her, be full of a bunch of kids that were from high socioeconomic backgrounds and had involved parents and really did well and started, frankly, at grade level and then ended the year 2 above, which teacher is better? And it's really difficult to do that.
It shouldn't be, though, Matt. It really shouldn't be. I mean, the fact that we don't have the means to risk adjust, right? Mm-hmm. We do the same thing in healthcare to compare one provider to the next. There are ways in which you should be able to risk adjust in terms of where the starting point was and what kind of progress was made from that starting point. these are not insurmountable. It's just there's such a protection of turf,
Right.
of status quo, of resistance to change. You and I could sit here all day and talk about all the reasons why people fight and oppose anything that appears to be disruptive. And meanwhile, our kids suffer. They're not getting the benefit of the kind of pressure to continually produce. In the private sector, right? The idea of continuous process improvement, I remember, being at a conference where they were comparing Kodak to IBM. Mm. IBM always had this group that they referred to as rule breakers, constantly looking at where do they need to be 5 years from now and testing ideas out. And Kodak did not keep pace. And of course, we know the end result. Kodak folded, and IBM has continued to succeed. And that, when we don't have those kinds of pressures within the educational system or in any government system, there's not that pressure to evaluate, is what we're doing working?
Before we move off the topic of education, the other thing, of course, we really should talk about is higher education. The University of Maine system, of course, has at times debated the wisdom of having campuses in certain locations, whether or not there should be, a Fort Kent and a Presque Isle, whether or not Machias should still be there. There's really, I think, only one University of Maine system school that actually comes out in the black financially. What do you, as you evaluate the University of Maine system schools, what do you see? Do you see a system that's too big, too small? Is it just right and we need to recalibrate what we do? And what is the state of higher education, broadly speaking, in the state of Maine?
Well, I would certainly suggest that we've got a lot of inefficient administration in the university system. The pressure has not been there to examine every aspect. We saw it in the University of Southern Maine not too long ago, right? They had a financial crisis that drove a comprehensive review of much of what they were doing to reach some prioritization. But absent that pressure, I don't know that we have seen it at a level that is needed across the entire university system. But it also has to be about what is the mission and what are they producing. My criticism is that the university is not aligned with what the workforce needs are in this state today and where they need to be 5 and 10 years from now. I want to know that the university system sees itself as integral to supporting Maine's economy and supporting our workforce. I don't know that that is, in fact, the philosophy within the university system. That's critically important to me, that it is aligned with. This 2 years ago or a year or so ago, when they came in with their budget request, they came in with a fairly significant budget increase request. I think it was roughly 10% increase. The budget map that I submitted that same year was less than what I had spent in fiscal years 16 and 17. And the argument that the university was making was that they needed to produce more nurses, more engineers. And my immediate question was, well, what are you cutting? What are you cutting in order to prioritize these critically important programs, engineering and nursing? That's what I did in DHHS. And I want to know that it isn't just please give us more, but how well are we doing zero-based budgeting and really analyzing all aspects of the costs within the system to make sure that it's producing the best possible alignment with what we need in the state.
Interestingly, higher education has basically what I would classify as hyperinflation in it right now. I mean, we've had, I think, some good luck in Maine trying to keep that tuition as down as possible, I suppose. But when you look nationally, you see inflation everywhere. You see student debt exploding. I mean, frankly, I still have student debt that I haven't paid off, right? The question about it, though, is how do you produce a sort of university system that is able to meet the needs that you're referring to and actually produce kids that are matriculating through it, that are able and ready for the workforce that they will then experience once they graduate. When you're faced with a competitive environment across the country with these other schools basically competing for students, and they're building $50 million student unions, and they have athletic facilities that are better than professional athletes, how do you marry those two things together and actually produce quality educational results that would actually even attract kids.
Yeah, well, I do think that quality and getting kids and parents focused on those quality outcomes, graduation rates. There is a huge concern about student loan debt, but my fear or concern about what the reaction has been to that is how do we eliminate that student loan debt? I think that's a problem, because the last thing I want is to now have no skin in the game and have students just not spending money, but getting access to education that is not cost effective, or they're not completing it. How many kids are leaving without a degree saddled with debt, right? We need to have greater transparency and certainly a drive toward quality. And I am confident that students and parents that are looking at a value proposition are going to come to the schools where they know there's quality. And we see that. There are certainly schools, Southern Maine Community College, there are schools in this state that are doing very well. I met with Glenn Cummings not too long ago. I'm very impressed with what USM is doing in partnering with the business community, in looking at ways in which their programming can be more nimble, better aligned with where the job demands are, helping individuals who need to retrain to be able to get into the new areas within the workforce. But there's got to be some financial pressure to do that. Otherwise, it's on autopilot.
I have a funny question for you. Do you think that everybody should go to college?
No. No, and I've said this.
It seems like what we as a society are telling all kids to do, though.
And I've said this repeatedly. I really am offended by the elitist attitude that I hear far too often within the schools that looks down upon the vocational training, the programming, when today we are desperate for plumbers, welders, machinists, electricians, you name it, HVAC. And these are good paying jobs with immediate job placement opportunities. The Association of General Contractors, I thought, had a brilliant strategy. They took the sports playing cards, and instead what they did is they put the picture of an electrician on the front, and on the back what the certification requirements are and what they could expect, what a high school student could expect to make in their first year, which we know that's of interest to these kids. What am I going to make? And they went out to the high schools and distributed those cards, worked with the guidance counselors to try and raise the not only the interest, but the respect for these occupations.
And awareness of.
And awareness. There's a crisis level.
And yet, at the same time, when you look at the community college system, which I agree has done some wonderful things recently, it seems like, and I don't have a good statistic for you on this one, but if I recall, it's something in the neighborhood of 60 or 70% of the degrees that are being earned there are kind of getting into the more liberal arts side of things rather than these trades, which is what they used to be. People are essentially going to community college now as a cheaper means of getting a college education rather than going to the full 4 years at the university.
Right, and I appreciate the cost-effective model that the community colleges are offering, but I am also concerned, and I've heard that criticism, that there's been a movement away from the infrastructure costs of having what's needed to do a welding program or a diesel hydraulics, or you name it. The phrase being it's cheaper to do chalk and talk than to invest in those programs. So I also want to see and understand what kind of commitment exists, because we've got to support that pathway. This is, what you just said, an awareness. We've got to underscore how critically important those jobs are to our infrastructure. I went to a machine shop in Knox County, small business, defense contracts, United States Department of Defense contracts with this machine shop. He needs machinists. Elmet Technologies in Lewiston, similarly. This company's been around for a very long time, and they are also looking at areas in the medical field that they're producing and responsible
But
for.
yet we have a society that's basically telling every kid that they have to go to a 4-year college, and you see the same statistic, quoted every time. Somebody who has a 4-year degree earns $1 million extra in their lifetime.
But here's an idea. Get a job and go to school part-time and not be saddled with student loan debt because you can pay for it. I met this young woman in Bucksport. She's into art, but she was in the welding program, and she was, of course, finding this beautiful complement between her interest in art and welding. She's immediately going to get a job when she graduates from high school, a good-paying job that she could use to support any future educational goals that she has. Mm-hmm. What's wrong with that?
Lastly, before we move off of education, though, since we're on the topic of higher education, I do have to ask you about free speech on college campuses, because this is something that we see a rather large problem nationwide. It seems as though commencement speakers that certain people disagree with are getting bullied into uninvitations. People who are coming onto a college campus to talk to basically a private group that would like to hear a certain speaker speak are protested, and campuses are shut down. People are told they have to leave, etc. We haven't seen that in Maine yet, but it seems, maybe a little bit, but we haven't seen it the same way. It seems, though, that no matter if we've seen it in Maine or not, this is a sort of national trend, and that young people today seem a little bit more hostile to the First Amendment. And the idea that perhaps the answer to something you disagree with is more speech rather than more restrictions on speech. Is there something government can do to maintain and protect that First Amendment right on college campuses more than they're doing now? Is this a problem that you see some action needed on?
Well, it's a great question, and I don't know that there's a government answer other than, I suppose, making sure that government money spent at college campuses is not restricting freedom of speech. And certainly we can make sure that we've got a laser beam focus on that. Government leaders should be modeling that behavior, that respect for the First Amendment, the freedom of speech. That, I think, is really important. I spoke recently to a high school, and it was certainly not a controversial discussion. It was a candidate forum. And after, I had a young student come up to me and tell me she was offended by something I said. And of course, what I said, Matt, it almost doesn't even make sense, and I'm not going to give the specifics just in case she happened to see it. But I said to her, well, let me just explain to you what I said, why I said it. I was comparing two populations and the importance of prioritizing. Mm-hmm. She was it's so hard to even describe, because this easily taking offense is what is shutting down healthy discussion and the respect for disagreement and robust debate. That's what we are about in this country. And I don't know if it's that we're raising generations that don't have coping skills.
Isn't that ultimately our fault?
It is. Well, it is our fault. Toughen up. My father, I can remember him saying to me, "Don't wear your heart on your sleeve. Have respect for yourself, and speak clearly your positions, your opinions." And we've done something. There's no doubt about it, but we got to get it back, because the answer can't be to keep our kids in some sort of a bubble so that they aren't offended by.
Indeed. Well, let's move off the topic of education, because we've been on it for quite a while. The topic of healthcare, though, of course, can go in just as many directions as education can. And obviously, the number one issue that I think most people in Maine right now identify as a healthcare challenge is related to the question of opioid abuse, because it's something that you see in the paper every day. You see that the numbers are climbing, more people are dying from it, more people are addicted to it, and you see it more visibly out in the world as you go to Portland or Bangor or some of the other places in Maine that have a high population. There was a story in the Portland Press Herald written about just a section of the city that has almost gone completely dark, where police are afraid to even go into, and the community doesn't feel safe anymore. The source of my question, though, relates to, again, what as governor you think can be done about the situation, because you have this response every legislative session where the legislators pass some form of bill that they say addresses the opioid crisis. It might not be perfect, but we're going in the right direction and we're doing something about it. And then the headline a few months later is Maine sets a record for more opioid deaths again. So it doesn't seem that whatever they've been doing has worked. Is there something that can be done that would?
Well, certainly there is an emotional reaction that often occurs in the legislature, a rush to find a silver bullet. Look, if there was a silver bullet to this, every state, the federal government, would be taking hold of it and implementing it. This is a complex problem where there is not a government solution. Do we need to make sure that government is performing an effective role in both law enforcement, prevention, and treatment? Absolutely. And I think we've done a lot on that front. But this, again, is one of those areas where we're seeing the results of the breakdown in family, societal challenges. I met with a group of women in opiate addiction treatment, and to the person, they said to me, we've got to be able to keep our jobs, because it's our jobs that are restoring our self-esteem, our self-confidence, our self-worth. And the reason that they were telling me this, Matt, is because the substance abuse treatment program that they were in was requiring them to participate so many hours every single day of the week. It was jeopardizing not only their ability to keep their job because of the self-worth and self-esteem, but to keep their benefits, also helping to cover the cost of the treatment. So we've got to recognize that individuals who don't have meaning in their lives, are not productively engaged every day, are going to be more vulnerable and susceptible to substance abuse. That is certainly something that has to be part of the equation.
But at the same time, you see a lot of high-functioning careerist, bankers and lawyers and what have you that have also sort of suffered this problem at the same time, oftentimes related to the fact that they were prescribed something for a back injury or some sort of ongoing pain need that they needed to have satisfied in some fashion, and then got hooked on it, and then prescription gets cut off, and then they search for some other thing to fill the gap for them, and that has been a big part of this as well. Is there anything in that?
So I'm very pleased. I helped write the legislation that the governor submitted to restrict the prescribing of pain meds. We know that 75% of those addicted to heroin started with a legally prescribed pain pill. And that there has been, when a kid goes in to have their wisdom teeth pulled and they're getting an opiate prescription, there's something wrong with that. So we know that we've had a huge problem in this country for far too long with way too many opiate pain meds being prescribed. So we've done a lot, but it's going to take time to move that in the right direction, although we have seen in Maine, because of that law, a fairly dramatic reduction in the prescribing of pain meds.
And one of the frequent criticisms you hear about that policy is that people who have chronic pain, who, quote, need the pain medication just to get on every day, are now subject to restrictions and aren't able to get the pain medication that they need as much. Is that something you consider a real problem? Is it something that's being overblown?
No,
what's
it's
going
overblown.
on with that?
The language in that, in fact, I think the language is too lenient in the law, as you know, the sausage factory that is the legislature, watered down some of the original language that we submitted. There are provisions within that law where a physician can certainly get an exemption for someone who warrants a higher dosing level. But here's the problem, Matt. We've convinced people, and this started a long time ago when Medicare started evaluating hospitals and doctors on how well they managed people's pain. We led people to believe that they could be, in fact, pain-free. And the amount,
or that they should be.
Or that they should be. And the amount of morphine milligram equivalents that people are on, it's frightening, because the overdose, the risk of overdose with that level of prescribing is equally high. So that is a significant concern in and of itself that we need to be aware of. I think what you also found are physicians who liked having that law to finally point to say, I can't prescribe you anymore. And we're dealing with the initial tension of that. But I think it's important to focus on, we're stopping the increase in the initial prescribing. So that's going to make a big difference. And the other thing that we did in the, certainly in the Medicaid program, and other commercial health insurers are doing this, is looking at other alternative pain management therapies, including chiropractic care, physical therapy, occupational therapy, and stressing those before prescribing a pain med. But I want to quickly touch on treatment.
Sure.
We've got a huge problem. There is a lack of real accountability and good results in the substance abuse treatment system. The results are not good. You have individuals who are either in going to a methadone clinic for 10, 15, 20 years with no real focus on recovery. And we've lost sight of that in what we are paying for and what we are incentivizing. There are some models out there that hold promise. There are some faith-based programs that we need to be highlighting and elevating in our payment structure. But that's a real concern. And just like anything else, you've got a system that has developed that wants to protect the revenue stream. And then it becomes all this emotional reaction. But we've got to keep asking the tough questions. Are we seeing good results in these substance abuse treatment programs? And if not, how do we move dollars to where it's going to work?
You know, one of the things that is frequently cited as a silver bullet, since you brought up the silver bullet theory, to solve this crisis is Medicaid expansion. We hear that a lot. When the Medicaid expansion ballot question was on just last year, that we heard that was a solution to the opioid crisis. When we were looking into that, as it circulated around that referendum question, we found some really interesting statistics that showed that opioid abuse seems to be higher in Medicaid expansion states than in non-states. Right. I'm curious as to why you think that is. Somebody who might have had no other health care options if they had no Medicaid, for instance, and might not be getting treatment of any kind, suddenly is given a Medicaid plan and is then able to seek services for their opioid abuse. Why is that somehow leading to more opioid abuse?
Well, I thought you were just about to answer your own question.
Well, that's what I'm here. You're here for.
You're providing unfettered access, right? Once again, it's a government program that really doesn't have the kind of safeguards and the kind of scrutiny that perhaps even a commercial health insurer would have in evaluating prescription, prescribing, doctor shopping. We've had in this state the prescription monitoring program for almost 15 years. It's still not being used as effectively as it was intended to prevent the doctor shopping. When you give someone a card, you are, and we've seen this in other states. In fact, we saw it in the state of Tennessee long before Obamacare. Tennessee led the country in Medicaid expansion and the percentage of its population enrolled in Medicaid, and it imploded. And one of the areas that they cite was a black market in pharmaceuticals and specifically pain medications, and the volume of costs associated with that. There's no doubt that Medicaid is increasing access to pain medications. And you're right. So
basically just by seeing a doctor and then getting more prescriptions for opioids? I mean, is that basically how it happens?
Oh, yes, absolutely. And it's a combination of the individual who may be seeking it out for themselves or the black market options of getting and selling the prescription to somebody else. So there's no doubt about it. It is not the answer, and in fact can be proven to be contributing to the problem. Here's what I know, Matt. We've substantially increased the funding for substance abuse treatment in this state, both in the Medicaid program and for the uninsured. It's not just about money. We want to make sure that individuals who need to get into treatment are doing that. I worked on setting up a program through 211, starting first with pregnant women, but also with adolescents. When they want to get into treatment, I wanted them to call 211, have a warm handoff immediately to a substance abuse treatment provider. We've got to make sure that the system that is today funded is getting people timely into treatment and then producing good results around recovery. It doesn't mean that someone isn't going to relapse. We know that's part of the equation, but there's got to be some measure of success that we're evaluating in the system in the best interest of those seeking treatment.
Yeah, I've heard a number of Republican candidates specifically comment on this drug problem that we have and going beyond the treatment and the Medicaid and all the other things that relate to that. I've heard things like we need to be, stopping people at the border and trying to stop the influx of drugs coming into Maine. How is that accomplishable?
Well, I know that what I'm hearing from folks is the decriminalizing. You'll hear often a phrase of harm reduction. And in fact, you'll hear that sometimes from law enforcement, police departments, because of the concern that you've got jails that are flooded with individuals who are abusing substances. The problem with that is there is a deterrent in having a penalty for breaking the law. And when you move away from that, and I know when I was growing up, a little fear, a worry about a consequence changes your behavior, makes you think about. And I am concerned that we have moved away from that. We've taken away that. When I met with those women in opiate addiction treatment, I said, one of the challenges too is we've created this political correctness around how we talk about substance abuse. Like, it's not an addiction, it's a disorder. So people start to get worried about saying the wrong term. When the governor did a press release about the number of drug addicted babies, do you know how many medical organizations wrote to him complaining about the use of the term addicted rather than affected? Mm-hmm. He's worried about the number of babies being born addicted to drugs, and they're concerned about whether he's using the right or wrong term. When I ask these women, how do we reach kids? How do we get kids to not go down this path? These women said to me, scare the crap out of them. We do not want kids following in our footsteps, having to, experience what we have. Stopping it at the border, look, we know that we've done a disservice in how we prioritize our resources. We're not investing in law enforcement. We're not supporting DEA like they should be. The Department of Public Safety has not had the kind of resources because DHHS, $100 million annual bailouts, crisis-oriented budget management at the state has neglected other significant priorities that are core to government, and that's public safety. And there's no excuse for it. So yes, I think we need to beef up, and we need to be working collaboratively with the New England DEA to be identifying where that heroin's coming from. I offered data looking at EBT transactions because I could see EBT card from Maine being used in Brooklyn, the Bronx, Lowell, and the DEA was saying, guess where the heroin's coming from? Brooklyn, the Bronx, Lowell. We need to be sharing this information in order to really aggressively go after the problem.
We brought up Medicaid expansion a moment ago as related to the opioid crisis, but of course that referendum did pass, and the legislature has been continuing to try to deal with what to do next about it. And as of us recording this, it hasn't done anything yet. I'm sure that special session will produce something.
I hope not.
Well, that's my question to you, is that I heard Governor LePage say the other day, I think this week, that he's sort of not even arguing about Medicaid expansion being funded or done anymore. He just wants to make sure it's done the right way to be responsible. What is your position on Medicaid expansion? If you were governor, what would you be asking the legislature to do? How would you be rallying the people of Maine to approach this issue? Should it simply be not funded? Should they repeal the law?
Repeal the law.
What would happen?
Repeal the law and not funded. Absolutely. There's no gray area for me. Everything that I did overseeing that agency was about getting our fiscal house back in order. That's why the governor was able to cut taxes, working with the Republicans in the legislature. That's why there's $200 million in the state rainy day fund. It's why there hasn't been an emergency bailout of DHHS in over 4 years. But here's what, Matt, the media will never talk about. Because we got our financial house in order, we've been able to substantially increase funding for nursing homes, to substantially increase it for assisted living, home care, for individuals with intellectual and developmental disabilities. We just talked about combating the opiate epidemic. We created and invested in an opiate health home to wrap around comprehensively the services that are needed for someone who is in addiction treatment. Mm-hmm. We have created significant support for primary care doctors. You will never be able to support that, and we will go backwards and end up with more of our elderly and disabled on waiting lists for critical services if we allow Medicaid expansion to go forward. No, absolutely not. The law needs to be repealed. We cannot afford. For that reason, to have it come at the expense of our elderly and disabled. But I want you to, and I'm sure you already have, one other strong argument is we don't need one more program that discourages someone from going to work. And that's exactly what this will do. If you fear that that job is going to cost you your benefit, your Medicaid benefit, we are going to further exacerbate the challenges we face today with the lack of a workforce and the undermining of our strong history of a proud work ethic.
I certainly hope that the audience understands that I'm playing a little bit of devil's advocate for the sake of the conversation. But as it relates to that question, you did have a rather comfortable margin pass it at the ballot box, and this sort of dovetails into a couple questions I'll probably ask you about, referendums broadly speaking and how we approach the initiative process. But, the phrase "the will of the people" is brought up frequently in this state, and there is a certain segment of the population that believes that if the people vote for something, it is the duty of lawmakers and the governor and everybody involved in public policy in Maine to respect it and to enact it as they have asked you, the lawmakers, to do. What's your take on that? I mean, do you think that there is a responsibility to do that and to honor at least the sort of the basic tenets of what the people voted for, or is the very notion of that flawed from the beginning?
It's flawed from the beginning. I mean, that process has completely undermined the legislative process, has hijacked our approach to effective lawmaking. But let's keep in mind what Medicaid expansion specifically is. It's a budget initiative, right? And budgets are debated every 2 years and sometimes every year, although we've done a much better job of getting away from supplemental budgets. So it is in the context of that budget that you are always evaluating priorities and determining how resources are allocated. I mean, the notion that 2 sentences on a ballot could ever allow for that kind of prioritization. There was no appropriation attached to that initiative. Voters weren't asked, where would you like to cut to raise the $400 million necessary to fund this over 4 years? What taxes would you like to see increased? So like any bill passed in the legislature, and you know this, many bills that get passed out of committee by the House, by the Senate, they meet their fate on what we all refer to as the appropriations table. They go down, having already been approved by both bodies, and then the appropriations committee says, I'm sorry, there's no money for this, and it dies. And so the will of the people, I think, is such an overstatement, first of all, because of the percentage of voters. I mean, we had, I think, 30% voter turnout, and then of that 30%, 60% supported Medicaid expansion, so you're talking about a fraction. There's a reason why our budget has to be in the legislature approved by 2/3 of the legislature to make sure that it is broadly reflective of the state, of citizens in our state. That is not what's happening with this initiative process.
Finishing up with healthcare before we move on to issues like that, I just want to sort of ask one broad question to you. When I ask Republicans and Republican candidates for governor about what their ideas about healthcare are, I typically get the answer, we need to get rid of Obamacare because it's standing in the way and we should just go back to PL 90, which is, of course, a law that the Maine Heritage Policy Center championed and tried to make a reality for quite some time. While I agree with every single word of that, it also is not the end of healthcare reform to me. I mean, there's a number of initiatives that we've spearheaded here that we care a great deal about, that we will continue to do so going into the future. What do you view as the next step? Because I have to tell you, I have absolutely no faith that the federal government's going to even deal with the question, whether they repeal it or they change it. I don't think Obamacare is on the table for them for quite some time. Maybe I'm wrong, but let's assume I'm right. What would we do if they do nothing?
Well, certainly we got to drive down the cost of healthcare. And we know that it is a system that is still incredibly inefficient, duplication of costs, a lack of, I know I sound like a broken record on the lack of accountability, but the fact of the matter is we have not had the transparency. When my son was told he needed an ultrasound recently, I could not get a straightforward answer of what it cost. And I've got a high deductible policy. So I've got a skin in the game.
Cash.
Right, I want to know. The notion that that is not readily accessible, but even beyond that, is it rational? Is the charge that you're hearing, does it make sense? Or why is it so different from one provider to the next, one hospital to the next? That is an area that we have got to create some focus on and drive reforms in. Now, I've done that at DHHS through the Medicaid program. We started publicizing, doing public reporting around not only outcomes, but looking at the cost of care. We've got to do more of that, because I think the public, when the public is armed with and has better information about, we need to support more informed decision making around.
But isn't a key to this sort of the consumer feeling the impact of the cost? I mean, the Maine Health Data Organization has been around for some time. We've seen published data on what things cost, and we also see that nobody uses it.
We've got to have skin in the game.
Where is the incentive in this process? How can people be brought into the decision making about what things cost before they make decisions?
Right. Well, unfortunately, or fortunately, I guess, depending on how you look at it, under the horrible one-size-fits-all federal regulatory structure of health insurance that is Obamacare, it has led to very high deductibles for many individuals. And that is creating more pressure to shop, to get access to information, to make decisions. You also have businesses, there have been some new businesses that have surfaced where their sole purpose is to work for a company to deny a hospital their payment until they can get good information about, I talked to a company here in Maine where they've hired one of these vendors, and they got a bill for someone, and the hospital bill was, $500,000. And there was no rhyme or reason to it. And this vendor helped to get the bill down to, I think, about $150,000. Well, I think we need to ask some questions about what was in there that never should have been in there to begin with. That's affecting all of us, the entire cost to the system. But let's go back to how do we get access or the opportunity as a state to have more flexible health insurance options so that people can get more affordable coverage. I am confident that the Trump administration is about to act on a rule that's going to allow states to get somewhat out from under the rigid Obamacare structure and maybe start to introduce some products that give us more cost-effective, more affordable health insurance coverage. But it's both. I just want to emphasize, it's both, right? It's the cost of care that's driving premiums, and it's a regulatory structure that is adding significantly to the premium cost.
Do you think that the direct primary care industry and sort of innovative approaches to healthcare like that have a role in perhaps bringing the cost of healthcare down across the board? I mean, you're talking about a relationship that has nothing to do with insurance anymore, and you have a $50 a month retainer that you're paying a doctor basically, and they have unlimited access to that doctor. Oftentimes they make house calls. And we see very few doctors currently taking that option and actually doing that, but there are some, and it's a growing group here. I mean, is the very nature of how we approach healthcare perhaps flawed?
Well, I think that's going to be the question after having had Obamacare in place for several years. Can you unscramble the egg? One of my concerns is the undermining of employer-sponsored coverage. And for employers who said, enough already, I'm out of this, can you get that back? So that's certainly one aspect of the coverage model that I'm concerned about. Can we unscramble that egg? But I think that the innovative model that you just cited has promise, but can it have enough of an impact? Will it ever be large enough? Will it ever have that much of a hold that it can influence and drive reform in the system?
I mean, it just seems to fight against, and I think you're right about that, but it just seems to fight against the very nature of where healthcare is going now, which is increased consolidation under mega hospitals that now own everything from dermatology to every specialist you can imagine, and also, of course, your primary care doctors and what have you. I mean, having gone through my wife having a few kids recently, I mean, it's like you're a number and you're walking into an assembly line when you go into this environment, and that's not what I think most people want out of their healthcare delivery. So there is a counter reaction in something like that. And maybe it by itself is not the solution, but I just wonder sometimes if there are things like that we can try to reimagine the very delivery of healthcare in the first place.
Well, and I met a doctor the other night who's retired, and he retired because I think he felt exactly that he wasn't having the kind of personal interaction that he went to medical school to have, the kind of care that he wanted to provide. Now, it doesn't mean that for the payments that they're receiving that there still shouldn't be accountability, but when the administrative burden becomes that overwhelming and detracts from the one-on-one patient care, it has so fundamentally changed. But I want to add one more to this. We've also created a system, Matt, of first dollar coverage. So, that ultrasound that I mentioned that someone wanted my son to have, I wasn't in favor of it. Right? I got the athletic trainer at the school saying, "Oh no, he needs an ultrasound." I'm thinking, toughen up. And I know that's, we go to get imaging to the doctor at a rate that is unprecedented.
Right, the $500 aspirin, right?
Right. I mean, it's just, I think we've also changed our expectations of the system. That doesn't mean I'm not detracting from good preventive care, but we have a higher expectation of access to the system than any other country. And that costs money.
It does, absolutely does. I mean, we could stay on this topic for a long time, but I think really briefly, since I did touch on the referendum process, I don't think we need to spend very much time here, obviously, because you're pretty on record, I think, as opposing ranked choice voting, and I think that the Republican candidates more or less sound very similar on the issue of reforming the ballot initiative process. But I do want to ask the question, I guess in a broad way, on your approach to how ballot initiatives work and what you think should be done to reform the system, whether or not, quite frankly, the initiative process needs to be repealed entirely, whether or not there's a constitutional amendment that does that, or whether you think that there are some sort of smaller changes that might have a more powerful impact and try to actually keep it what I think it was originally intended to be, which is the actual voice of the people rather than special interests, which we've seen it be recently.
Right. Well, I think we have to understand what it is that we don't like about what this process is producing. You just identified the influence of special interests, of out-of-state money. How might we reform to guard against, to insulate against that? I think we also have to go back and think about the original intent. What kind of policies are appropriate to have an initiative seek to affect, implement, influence? Budgets, to me, that seems to be way beyond an appropriate use of the initiative process. So I think we need to really take a look at maybe there are some constitutional amendments that need to be part of our consideration here, evaluation for what the reform needs to look at. So I don't go to immediately to repeal, but I do have serious concerns about the lack of geographic representation, from the signature collecting, which I think we've all talked about. How do we raise the bar so that signatures have to be collected in all the Senate districts? Here's the most encouraging thing that I can say about this, though. Everywhere around the state that I have been, groups that I have met with, it is almost universal. A question comes up about it and people are angry. And that, I have to say, surprised me, that individuals were that up in arms about the initiative process. And it never was about one specific initiative. It was about
just
this process has to be reformed. Why is that encouraging? Because if we can come up with the common sense reforms to it, and we get that out to the public, they will put pressure on the legislature to respond and to move those reforms forward. I am confident of that.
I sincerely hope you're right. In the time we have left, I wanted to cover a couple issues before we let you go. And I think one that is, of course, expected of all sort of conservative or libertarian candidates would be the issue of taxes. It's something that seems to more or less unify the political right. I know that all the candidates that are running for the Republican nomination have been saying that taxes are too high and need to be lowered, although there there is some gradation on exactly what each candidate wants to do about it. So when you look at Maine's tax environment, you've seen, of course, the income tax go down more or less slightly, by about a point or so. And there's been a lot of fighting along the way about that being tax cuts for the rich and so on and so forth. Where do you see Maine's taxes being with Mary Mayhew as governor? Where would you like to bring them? And more importantly, because this is the question that I think we miss all the time, is how is that politically possible? The Maine Heritage Policy Center, for instance, favors a 0% income tax. If you made me emperor of the universe, I could make that happen. But in an environment where you have oftentimes hostile legislature, how do you continue to get progress in that direction?
And every time I'm asked that, I start with a response of, look, I was told you'll never get DHHS finances under control and you will never reform welfare. And I led the charge to do both alongside the governor. That is what absolutely gives me the confidence and the optimism that we can turn our tax structure around, that we can eliminate the income tax. I'm asked often, what will you expand in order to compensate for?
Sales tax, right?
I don't start there, Matt. Look, I know what kind of wasteful spending exists in state government. I got rid of a lot of it, but there's a lot more because there's just such emotions tied up and a lot of the spending that is government shouldn't be doing to begin with, or there is that protection of status quo. There's opportunity to not only continue to cut spending, wasteful spending, to support elimination of that income tax, but here's the other thing. Look, the way that fiscal notes are developed, it's a look in the rear view mirror. We need this much revenue to support these programs. We need to do dynamic forecasting. We need to look at when we cut this tax, this is the economic activity we're going to see, and it is going to more than increase the revenue streams into the state. Here's what is fundamental to this debate. We will not keep the businesses that are here today if we don't get rid of that income tax. I look at businesses around the state and I marvel at how many of them are still here. Much of that because they're committed to this state, but how long is that sustainable?
That honestly seems to be the thing. People point at it a lot when either people or businesses continue to stay here even though that it's outside of their economic interest to do so, and they say that it's because of the quality of life and they're so in love with the state of Maine that's why they're here, and thus that's going to be the reason that other people come. I hear this all the time when we're talking about this. When I've testified in the legislature, I hear this argument a lot from certain segments of the population, and yet my best man at my wedding is living in North Carolina because he has a house that's twice as big as mine for half the cost, and he gets paid $50,000 more than he would have here. You have a tax environment there that's a lot lower. It's the same thing in Texas and Florida. It's the same thing in Arizona,
Tennessee.
New Hampshire. I mean, you name it. Colorado.
Right. Right.
So I definitely believe that taxes are a significant factor in this, because if you get paid the same amount of money in one place and you compare it to Maine, you're going to take a pay cut to move here because of the tax environment. But it also is about how much you get paid doing that job in the first place, and we are typically lower than other places. It's about how many of those types of jobs you have. I know a friend of mine moved to Florida because there was really one job he could do here, and that job went away, and he had no other option, so he went to Florida where there are hundreds of those types of jobs. What do we do to sort of try to attack this problem of not only people leaving the state, businesses leaving the state, but people never coming here in the first place, beyond the tax question?
Well, I'm not sure you can get too far beyond the tax question, because I think the tax question plays into everything that you just described. You can't pay the kind of competitive wages if your cost of producing is that much higher because of the tax burden. We're not going to keep our young here to have the robust workforce if the opportunities are elsewhere. I do think that the tax and the predictability of the business environment are incredibly important to not only preserving the businesses that are here and helping them to be that much more successful, but if I'm a business looking at Maine, I'm probably going to call a business in Maine to determine whether or not the environment is really all that. And they're not going to get a good answer today. So I do think we've got to be aggressive. Look.
I mean, are there things, I apologize for interrupting you, but are there things like the labor environment that can be done outside of taxes. I mean,
Well,
I'm
right to
specifically
work.
asking right to work.
Right to work, absolutely.
Do
Absolutely.
you think that that would attract businesses by itself with that one change?
I do think it would help. There's no doubt about it. I just think we're at such a lopsided disadvantage
Right.
compared to Kentucky, Texas, Florida, Tennessee. I think right to work in New England, Matt, would make a huge difference for us. But to compete with any company that may, or to compete with a company that is looking at some of these other states in the southern United States, right to work alone is probably not enough to tip the scales.
Mm-hmm.
But in New England, yes, it would absolutely make us more competitive. I want to give you some hope here. We reduced Medicaid enrollment in Maine by 25%. We took over 80,000 people off of the program and got them on a very different pathway. We've taken over 60,000, moved 60,000 off of food stamps by incentivizing work. We reduced our TANF cash welfare rolls by over 80%. What most would have said was absolutely unattainable, that you would never do that, and we've done it. I know with that same fierce determination and conservative principled leadership, we can accomplish the same with our economy, but we've got to get voters in Maine, citizens in Maine, engaged in the process to create the pressure on the legislature to do the right thing.
Well, given the fact that you have to balance your budget every year, and unlike the federal government, you can't just go into debt to cover the balance, the question of spending becomes intertwined with taxes, because it's just simply impossible to lower the income tax if you're spending record amounts of money. And Governor LePage has been a great ally to people who want to control spending over the years, but even under his leadership, it's grown far more than I want to see it grow. And at the same time, you look at the New Hampshires of the world, and you see that they spend about $1 billion less on welfare, for instance, as us. They literally are able to get away with not having an income and a sales tax because they spend less money. How do we culturally change the state of Maine so that it's possible to curtail the spending to a degree that would allow that rate to get down to 6, 5, 4, 3, 2, and then down to 0?
I mean, we've made a great dent in that and in that cultural attitude, but you can't in 7 years dig out of a crater that was dug over 20 years. You can't change the attitude overnight. And I think we've made a lot of progress, but I know I put $140 million worth of cuts in the last budget that I submitted through the governor. And those were not to fill a hole in DHHS. It was to go towards tax cuts, to go toward whatever other priority the governor had. Those cuts were all rejected. I had said to the governor, look, you've got to have a quarterback on this. I can defend the cuts, but to protect that money and to target and prioritize it for tax reductions, you got to have somebody championing this through the process. I am confident, Matt, that there are so many more opportunities to reduce spending across the board in all these agencies, and every dollar adds up. And it doesn't mean sacrificing the core functions of government, making sure that our roads and bridges are getting the proper investment, but there's still significant waste in government. And you're right, we do. We spend too much, and we've created a level of dependency and a lack of accountability that has led to this spending that a neighboring state, New Hampshire, not only spends less, leads the country with its per capita income. There's just no reason that Maine isn't competing to do the same here.
You know, I mean, you know as well as I do that for all the talk of zero-based budgeting and starting over from scratch every year, you know, the previous year's budget basically builds the next one. And that seems to be the mentality, you know, of the legislative body, seems to be the critical reason why this happens. Because if you spend $166 million more on education this year, that becomes the new baseline. Whether you think it's zero-based budgeting or not, it's the new baseline. And that any time a smaller number comes in the next budget cycle, it's referred to as a cut because, you know, of course, the previous year we had X, which is what the pressure it's why the pressure, continues to grow spending year over year for virtually every department. A governor's not an autocrat. I mean, how do you work with the legislature to do that kind of thing when they've been so hostile to it for the last 8 years?
Right. I mean, I've done it. Once again, of all the candidates, I really have done it. I put my budgets in, and most of those budgets went through. And we dramatically reduced.
But at the same time, you tried to, and I give you a lot of credit for this, you tried to eliminate wait lists, for instance, and then it got through the legislative budgeting process, and the lawmakers got their hands on it, and suddenly there's 3,000 people on waiting lists again.
Right.
So
No.
they do, even with good stewardship, they do
Well,
a lot of really insane things.
Yeah, I haven't been governor yet.
Right.
Let me be governor, all right? I am going to be responsible at that point for the entire budget. I think I've done an amazing job with a third of the state budget. Let me at the rest of it. And I will work with the legislature, but the way that you influence the legislature is also by making sure that the public is aware of what the options are. The reason we prevailed in defeating Medicaid expansion is because we made it clear, I made it clear, the governor made it clear what was at stake, and we communicated effectively with the public. When you think about in 2014, when the governor ran for re-election, we had dramatically reduced food stamp enrollment, Medicaid enrollment, TANF, and he won by more votes than any governor in the history of this state. And that's after all of those, what the Democrats argued were outrageous, controversial reforms. They were wildly popular. And we have to make sure that the public has a seat at the table and is informing, because it's their money. Let's be clear. It's the taxpayers' money that's being misspent, that is informing that next baseline. I want their paychecks to be front and center in these discussions, because that's whose paychecks are being raided to pay for these bloated programs or unnecessary programs. And I will make sure that that's front and center in the discussions.
Before we leave the topic of government spending and taxes and also a little bit about referendums, we do want to talk about this enhanced minimum wage, which of course was passed by referendum as well. And I guess, how we're reacting to this is another question that the legislature is dealing right now. Do you leave it as is, which had a tip credit reversion in it? Do we delay it a little bit longer? Do we make the increase happen just less of an increase? There seems to be a variety of opinions on this. Some people say that a minimum wage isn't even legitimate in the first place.
Well,
where do you come on this?
That is my view. I don't believe.
So you'd like to get rid of the minimum wage period?
I don't believe government should be setting wages. Anytime government, government, we were talking about this with healthcare. Government has no skin in the game. Government does not stand to win or lose in that equation. It is not respecting the economic model. I met with a family that runs a grocery store on the coast, and the gentleman, the owner, said to me, look, this is adding $30,000 worth of cost to my business. I can't increase my prices of groceries. So I'm eliminating a job, and my wife and I will work more hours. That, they understand economics. When the legislature or government is debating a minimum wage increase, they're not taking any of that into consideration. So no, I don't believe that there should be a minimum wage.
So is it your belief that it basically causes inflation anyway? And so, that's essentially where we fall on the question. You have the rise in the wage basically canceled out by the increase in prices that those people are subject to paying when they go for groceries and whatever.
It's basic economics, right? And I guess I understood the pressure to address the tip credit, but I felt that it undermined the broader opportunity to repeal the entire initiative around minimum wage.
So as governor, what would you do about it? Would you be, again, back to the will of the people, would you be seeking to implement it in a more responsible way, or would you go for a straight repeal of the question? Do you think that's even politically possible?
Well, I'd probably take a look at the political opportunities to either further undermine it by dealing with a training wage. Really, when you think about it, the vast majority of individuals affected by a minimum wage were the wait staff. So you already have taken a significant percent out. Then you start dealing with kids. You're removing yet another significant percent. No one was paying attention to the fact that the vast majority of individuals that might have been subjected to the minimum wage were either wait staff who weren't really earning minimum wage or 16-year-olds. So I think there are ways in which to ultimately make it moot by undermining it.
Well, we don't have very much time left, so I do want to spend just a moment with you on the question of energy before we move on and wrap up. Obviously, energy costs are a significant concern to not only businesses but also consumers. It's actually frequently cited by businesses as a reason why not to come to Maine. At the same time, we are, of course, the cheapest in New England, so I guess regionally we're doing okay, but of course across the country we're not. What can be done to actually make the cost of energy go down? What do you favor and what would you pursue as governor?
Yeah, I would stop having government being the business of picking winners and losers, creating subsidies either direct through the ratepayers or even the tax credits that are creating a burden on taxpayers. Government should not be in the role of picking winners and losers. And then I want to take a look at environmental policies that have discouraged opportunities to support more affordable energy options in this state. We know that it is a huge obstacle barrier to Maine having the kind of competitive economy. So we've got to take a look at what the answers are. I mean, obviously, the United States now is what we lead the world in oil production. Well, that was not the case 15 years ago when we were concerned about, I'm not saying you should ever be dependent on one energy source, but in terms of the drive to reduce our dependency because of the cost or the fear about access, that certainly has changed over the last 15 years. I want to make sure that we've got a diversified portfolio. You look at Massachusetts as an example, they are highly dependent on natural gas. There is a report that came out here recently where they're going to start to see rolling blackouts, in the next couple of years. So we want to make sure that we've got diversity, but I think we want to really keep our focus on what are lower cost energy.
My final question for you really is more of a wrap-up question, and I guess it just relates to everything we've talked about today. Of the things that we've had an opportunity to speak about, or frankly something that we missed and we left out, do you have a specific issue that motivates you more than any of the others? Is there a singular issue that you'd like to be defined by when you become governor, remembered by, part of your legacy? Is there something that animates you more than anything else?
I'm sure that it comes down to my fundamental concern that the growth of government has undermined the fabric of families, has detracted from business investment and opportunity, and I see those two those connected. You know, for families to succeed and thrive, for children to be able to stay and have great opportunities, we need a vibrant business economy. I want to make sure that we get government out of people's lives, out of their pockets, out of the accounts of businesses, so that families independently can succeed, can thrive, businesses can grow and flourish, our state can be looking at a much brighter economic future. All I've seen for far too long has been this defeatist attitude in this state that Maine has always been a poor state, it'll always be a poor state, and so the answer for far too long has been to grow government. And it isn't just about the economy, Matt. When government grows, it inevitably takes away our freedom and liberty, and that should be concerning to all of us.
All right, well, I want to say a quick thank you to Mary Mayhew for spending so much time with us. I've lost track of the clock, but I think we got a pretty decent overview of exactly what you think about the major issues that are affecting Maine and what you might be dealing with as governor. So again, I want to say thank you for joining us. Coming up soon, we will be talking to the other Republican and Democratic as well as independent candidates for governor, and we'll be trying to hit them all before we get out of here. And hopefully that will help you make your decisions in the upcoming election with a more fully informed idea about what policies all of these folks support and where their positions come down on all these issues. So thank you very much for the initial appearance here by Mary Mayhew, and stay tuned for much more coming from the Maine Heritage Policy Center.